The Tomah Health Warrens Clinic is now offering a new service that says it will enhance patient care and make a visit to the clinic a bit easier. Tomah Health Emergency Services and Warrens Clinic Director Suzanne Downing joins us on this edition of HealthCheck360 with all of the details. Welcome back, Suzanne. We've had you here before.
Yeah, Suzanne.
Yes.
Right. How you been?
Good, good.
Okay, let's jump right into it.
All
What is going on for the viewers who know all about the Warrens Clinic up there? Something happening?
Sure. We are now offering same-day and next-day appointments as we transition out of a walk-in model into a clinic that's taking appointments.
This is a big deal?
It is a big deal.
Okay, so up till today, you could only walk in.
Correct.
And now you can call in and make an appointment.
You can, yep. The same day, for the same day or the following business day.
Now, is it either or is it both? Or?
We are still allowing walk-in visits. If we have a provider available to do the visit at that time, we'll slot you right into that appointment.
Suzanne, why the change then for Warrens that you're transitioning to appointments?
Sure.
From the walk-in?
What we're finding prior to appointments was that a number of people would perhaps come in at the same time, and it would create kind of a bottleneck in the flow at the clinic, and it was leading to longer wait times. So what we're hoping to do with transitioning into an appointment-based clinic is to help reduce patient waits and to improve the flow of the work at the clinic. It'll be a staff satisfier as well as a patient satisfier.
How big a clinic is that in there? And what kind of services do you offer?
Sure. So the Warrens Clinic is a small clinic. We have 5 exam rooms. We do staff with a provider Monday through Friday, 9 a.m. to 6 p.m.
Okay.
And we see all types of minor illnesses and injuries.
You do x-ray?
We don't currently do x-ray.
Okay, right. But they do lab work?
We do. We have a little lab out at the clinic. We can draw blood samples and send them over to the hospital if needed. But we do all sorts of lab tests like mono checks and streps and urinalysis, things that are more common minor ailments. Right out of the same provider that you would see if you go for an appointment at the clinic is available by telemedicine from the main hospital website. We are offering walk-in services at this point still, so it is the convenient care when you're ready for it. But now with adding in appointment times, it really does help.
So the question I would have maybe for our viewers is there a deadline? So you can only, or is that going to be kind of fluid for
as far as taking walk-ins?
Yeah, what's the timeline? Or do you know?
The timeline is pretty fluid. We want to be open and available for our patients to come, and we'll get them in if we can. If it gets to the point where we are full every day with appointments that have been made, then we'll look at moving on to the next phase in our transition.
Then walk-in becomes a problem, doesn't it?
It really does, yeah.
Okay, sure.
Yep.
Then you have to send them to the hospital.
That is one option.
Well, yeah, that is an option.
And we do have the urgent care at the hospital, so that's that is an option for walk-in care as well.
Good update, huh?
Yeah, Suzanne, thanks for joining us again.
You're welcome. Thank you for having me.